the University of Vermont said, let us see what they have. And then I believe it was that evening, Dr. C called us back. I think it was like 7:45 at night, saying, I have good news and bad news. And I'm like, okay. And he said, your tumor's larger than what your local hospital had said, what they had measured. But the good news is now you qualify for our clinical trial and we have 1 seat left. Do you want it? So I said, can I think about it? And if you know Dr. C, he's like, well, I need to have an answer right away. And I said, okay, I'll take it. And then our journey just started. I was very angry. We had just lost our son 5 months previous to this, so I was very raw, not in a good place. And so I was very angry, thinking, you just took my son, and now you want me. But I thought, I've lived through losing my son, and if I can do that, I can do anything. So I was kind of numb. I didn't really even think about me. I was thinking more, well, maybe I'll be with my son. And then as my journey kind of continued, I could hear sense from my son that I needed to stay here to be with my husband and my daughter. And then I said, I'll just be Vermont strong, and I'm from Franklin County, and I'm a very determined, strong person. And I said, okay, let's bring it on, let's get this done. I had very determined that I'm a list person and a schedule person, so when they told me I was going to do A through Z, I said, that's what I'm going to do. I'm not missing any treatments, I'm not letting this cancer win, and that's what I did. We had gone back to Vermont for 3 weeks in August for a wedding, and he called me and he said that there was a brand new procedure out where instead of having little triangles, there were like A, B, C's or D's now marked on it, and that just the technology had just advanced, and that he really felt that would be the best option. And how did I feel about that? And I said, I'm all for anything that's advancement, anything that can make a success for myself or any future patients, and absolutely. And he asked if they'd be willing to allow the procedure being videotaped in the surgery room, and I said, absolutely, anything I can give back to help, I definitely want to do that, and I encourage anyone else to do that. The placement actually was relatively painless. It was very similar to having a mammogram. Would do it like you do a mammogram, and they had placed little dots where they exactly go, and then there was like a little injection. There had been some topical freezing, so you didn't really feel anything. And again, the nurses and technicians were just wonderful. They explained exactly what they were doing. I think the procedure was less than 10, 15 minutes. It was very, very quick. From what I understand, the old procedure, you'd have wire sticking out of you or something. So this definitely was much more accommodating to the patient and more relaxing. I mean, I can't imagine seeing you having a wire hang out until your surgery, which could be a day or two, I guess. So.
In fact, it appeared on MRI when she was finished with the protocol that her tumor had resolved. And we needed to verify that the tumor still wasn't around anywhere in her nodes or in her breast, and we placed Scout MDs into her breast to be able to offer her an opportunity at breast conservation and to assure that we took out the spot to sample any breast cancer that was left. Her odds of surviving will be extremely good, and she was able to keep her breast because we're able to use Scout MDs to take these areas out. So we're able to do very large areas of multifocal tumors where we can put markers in and bracket large areas using the Savvy Scout MDs to offer people breast conservation that we would have never done before. So this is enhancing the ability to offer breast conservation, which really in the end will kind of become more the standard than performing mastectomies for people and having to reconstruct their breasts.
So if my story can help someone else with their fears or apprehension about cancer, I just want to give back. I just feel if someone hadn't shared the knowledge with me, I may not be here. I may have been at UVM and not got the treatment that I got today. My name is Lynn Blouin, and I am a breast cancer survivor. I kicked cancer's butt. I am Vermont strong.